more as a normal year, but a normal year. Thanks so much. This was really fascinating. We appreciate your time.
Yeah, thanks so much.
With that, we'll next welcome Angela Moore from Howard University Hospital, who will present on improving turnaround times for chest, abdomen x-rays in the PACU in an academic medical center. Angela?
Hello, and welcome to the turnaround time study performed by the diagnostic radiology team. My name is Angela Moore, and I am the lead technologist. Howard University Hospital Radiology Department is focused on improving how care is delivered to our patients. In one prominent case, in 2018, an X-ray report took longer than the average turnaround time. As a result, it delayed patient care discharge. Our poster depicts a turnaround time for chest abdomens performed in the PACU. The 7 occurrence sample ran from February to March of 2019. Occurrence number 1, which has the longest turnaround time of 53 minutes, was met with a few challenges. Challenges that may have occurred are equipment availability, the availability to process paperwork quickly, and radiologist availability. After the first occurrence, the minutes to X-ray results got increasingly shorter. The goal is 45 minutes or less. And since the purchase of the new digital equipment, the turnaround times are even shorter. Images go directly to PACS anywhere within the hospital. That concludes my presentation, and I am open for any questions.
Thank you so much. I'm looking at your poster, and I'm noticing that first trial that you mentioned was in red. How did you guys identify what might have caused that? Was there a root cause analysis, and how did that inform what you decided to do to improve to make that 14-minute turnaround, which was so much quicker?
Well, that was actually the first one we did. And I think all of the links were not together. In one area, it was quick from notification, getting the X-ray done. But when it came to the end point of actually reading, the radiologist's availability was lacking in that area. So once we got everybody on board, especially the radiologist, it flowed a lot nicer, a lot quicker.
Yeah, and you mentioned getting them on board, and I'm thinking about that culture presentation we just had. How did the staff feel about the project to begin with? Were they excited, or did it take them a while to get on board, and how did you approach that?
When the study first started, I wouldn't say they were excited, but it was something that was great. It was like, hey, let's see how long this takes, and let's see, what the problem was. Like I had stated, in 2018, we had a case where it was the report that took too long to get to the PACU. So the technologists were very much on board. It's something that we were always doing anyway, as far as going down, performing the X-ray, coming back, and trying to get the process going as quick as possible.
That makes sense. And I'm thinking about sort of the impact of one case versus multiple cases. Did you have a sense as you were going through this? You mentioned a case example of how much these turnaround times are impacted by potentially, one case that's an outlier versus, usual process. Are you able to have any insight into that? What might that look like?
Every day is a different day. Availability of equipment, availability of the elevator, depending what radiologists are reading at the time the technologist notifies them. Each instance is different. The occurrences number 4, 5, 6, it has 0 for notification. That means that there was actually a technologist at the front desk when the notification came through. So each scenario is different. Every day is different.
Yeah, particularly if you're going to have somebody sometimes at the front desk or sometimes right there and sometimes not, then thinking about those dynamics. And that's interesting too, the impact of transport around the hospital. I admit I wouldn't necessarily have thought about the elevator and that, although perhaps I should have. Now, as soon as you mentioned it, I was sort of having one of those dull moments where I thought, that actually makes sense. The elevator. Was there an impact? I'll ask it since somebody asked a question about COVID in the last one. Was there an impact on this that you saw as we were sort of in the height of the COVID response, given limitations in PPE and how you're trying to isolate folks versus not? Was there some juggling or some creative workarounds or other kinds of things you had to address?
Not really. Once the COVID started with us, we all just got our gear and we carried our gear no matter where we were, whether we were on the floor, whether we were doing portables in PACU, portables on the floor, we always had our PPE with us. So it was really not a problem. Yeah.
Thanks for insight on that. We got questions rolling in. People are really interested in the topic. And these two might be either you have answers or they're food for thought for you for the future.
Okay.
Have you had any insight into impact on the patients with the improved turnaround times, like improved satisfaction or a deeper dive into health outcomes to show sort of an outcome related impact of quicker turnaround times or, sort of case studies or stories around that?
This was the first one we actually did in our department. So I think in the future, we will be doing a different one. One that deals more with the operating room and the cases and how long it takes for the technologist to come from the radiology department to the operating room. So that will be another very interesting case to see how long it takes. And there are many links there, many links.
So you've already sort of picked another project. Did that one come up because you were looking at some data and saw that as a potential next thing, or did someone from the staff bring up, hey, now that we've done this once, this might be an idea? How did you identify that next idea?
I think the director of the department, it is a topic that is discussed in one of the morning meetings. And I think that is how that has come into play. I think that's going to be a future study for us because it is a daily topic in the morning management meeting.
Right. So using those morning management meetings to identify potential opportunities for improvement and then, figuring out how to follow up on them.
Yes.
Yeah. Oh, that's a great model. Where we are, I think we had a lot of interaction and questions on this one. So thanks so much for being on the hotspot and answering them. And thank you so much for sharing this work.
Thank you.
All right, we'll now move on to our next presenter. Next, we'll hear from Ivory Benjank from the George Washington University Hospital, who will present a poster titled, "Are We Ready for Smart